Good afternoon, everybody. Thanks for taking time out of your day to listen to this video and watch this video on the 0821 non-balloon replacement PEG tube. The non-balloon replacement PEG tube is intended to be used in an existing percutaneous endoscopic PEG site once the original PEG tube has been removed. During this video, I will be discussing the removal of the existing initial placement PEG device, the prep and insertion of the new non-balloon replacement PEG device, and then lastly, the removal technique of the non-balloon replacement device. And we'll also discuss and demonstrate the various items that come in the 0821 non-balloon PEG replacement kit. At this time, I'm going to discuss the proper technique for removing the initial placement PEG. But remember, this patient has to have a mature, well-established stomal PEG tract prior to removal and prior to installation of the non-balloon PEG device. Another important thing to keep in mind is be sure to have some sort of drape or 4x4s that can cover the PEG site prior to traction removal. That'll just eliminate any biomaterials from contacting anyone in the room. Prior to removal, of course, make sure the operator has gloved hands, face shield if necessary, because there's an occasion where body fluids may fly out, go into the operator's eyes, and so on. Another word of advice for you, if you're in the room, do not stand immediately in front of the site when they pull it to protect you from any bodily fluids from the patient. So what I'm going to do now is simply demonstrate the technique. What I will do is just wrap the tube as much as I can around one hand. With the other hand, I'm going to put pressure here just to stabilize the patient's tissues and try to decrease any potential trauma of the tube coming through the tissue. Along with that, I'm going to use my trusty 4x4s to cover the site and then simply pull. Here we go. It's very simple. The two key components of the non-balloon replacement PEG kit include the obturator, which I'm holding here, as well as the non-balloon PEG kit or non-balloon PEG tube as seen here. The obturator has a silicone protector. Remove that. The obturator tip gets inserted into the dimple hole of the mushroom of the PEG, and then it's stretched. I'll demonstrate the technique here in a moment, but included besides these components in the kit, we have the following. Large 4x4, some KY jelly, the 4x4 to cover the site or clean the site, and the KY jelly to lubricate the non-balloon device prior to insertion. Thanks, Whitney. One of the critical elements prior to placement of the actual device is to determine the direction or angle of the well-established stomal tract. In other words, we need to find out which way the angle of the tract is. And to do that, simply lubricate the tip of the obturator, place it into the tract gently, and see how it falls and see which direction it falls. As you can see here, it's falling to my right, or it would be your left. It's important for the clinician to make a mental note of that direction and apply that direction while installing the new non-balloon replacement device. So, let's get started. At this point, the clinician should take the obturator, take the metal blunt-tipped end, and insert it into the dimple hole that was molded into the dome. Simply stretch and then grab and hold tightly. As you can see, the mushroom went from a circle or a round structure to an elongated oval structure. That's the whole principle behind placement. At this point, the clinician should generously lubricate the dome, the tube, and the obturator. When I removed the initial placement device, you saw me place 2 fingers here, or my fingers like so, in order to stabilize the tissue. I'm going to go ahead and do that again during the placement of the non-balloon device. Remember, we made a mental note of the angle of insertion from right to left. That insertion angle is critical to proper, safe, and comfortable placement of the device. So here we go. You're going to see me push it in. You'll feel it pop. At that point, I keep the obturator held in place and release the tension that I placed on the non-balloon replacement. By releasing the pressure on the non-balloon device, the mushroom returns to that round, circular position, and then I know it's secure inside the stomach. At this point, I remove the obturator, again leaving my fingers here to support the tissue. Set the obturator aside, and then gently tug on the device to assess that it's secure. On this device, I have 1 centimeter of device inside the patient, and that's I can see that on the markings on the peg tube. And in an established peg site, you may not see any more than 2 or 3 centimeters of device inside the patient. I rotate the device rotates very easily. I gently tug on it to assure that it's in the proper placement. And then at this time, I can secure the external bolster with the help of my assistant near the skin. Occasionally, you may see a 2-handed technique used for placement. That is incorrect. Again, the proper technique is stretching the device with one hand and controlling the obturator, using the second hand to stabilize the tissue, and then place the device. Now that I'm comfortable knowing that the tube's in proper placement, I will go ahead and clean my peg site of any excessive lube, blood, or biomaterial. And then with the help of my assistant, we'll use the 2-handed technique for stretching and sliding the external bolster against the stomach skin. Remember, you can leave 1 to 2 centimeters of play between the bolster, the external bolster, and the skin. As you know, the tube's Y-port adapter is already connected. At this point in time, the physician or care provider may want to insert air to confirm placement, or water to confirm placement, or to do gastric aspirate. And then just simply close the ports. And then the operator can, or the end user can tape down or secure the device as they normally would. So, that was the technique for proper placement of a non-balloon replacement peg device. What I'm going to demonstrate now is the removal of the device. As you're well aware of, this is also a traction removal device. Proper technique is as follows. I'm going to take the external bolster and slide it up the tube first. And I just simply grab and slide it up. I'm also going to rotate the device to make sure that the inner dome or the interior dome is not entrapped by any tissue. And I can also slide the device in and out of the stomal tract, as you can see here. So I know now that the device is free and not engaged in any tissue. Then, as with the previous initial placement device, I take my 4x4, cover the site, stabilize the site with my fingers as so, and tell everybody to get out of the way and pull. It's that easy. And that concludes this training video on the 08-21 non-balloon replacement peg tube. Wasn't that easy?